Hi, my name is Bill Goolsbee. I'm the founder of Epiphany Therapeutics. I'm going to take a few minutes to tell you about Epiphany, what we're interested in, and what we do. I started Epiphany Therapeutics out of kind of a personal project with a colleague of mine as we got to the point where we had a little more retirement flexibility and thought about what we wanted to be able to do in the future. And we started to work around one complex that we call essential micronutrients. We've all heard of a lot of the essential micronutrients that are purported to help manage inflammation. What I was interested in particular was being able to manage local inflammation in my knee, not by taking 800 milligrams of ibuprofen or naproxen or aspirin. I wanted to manage pain locally. So we had to have those special micronutrients that are anti-inflammatory, had to have them available to penetrate through the tissue. So it took a while to figure this out because most of those things, unfortunately, don't absorb well. We've all heard that taking high doses of vitamins, ineffective because we don't absorb them. The same is true for absorbing them through the skin, through the fascia, and getting to the site of need. It took us a while. We figured that out. Experimented with how much, how frequently. So we got to the point where I was satisfied that I was getting meaningful amounts of relief in my knee and that the pain was manageable. It was consistently manageable, whether it was in the daylight or when I tried to sleep. So over time, all of a sudden, friends of mine, people that I skied with, people that I hiked with, wanted to try what I'd come up with. So I started providing them with small sample products. Pretty soon one day I was standing in a chairlift line to ski, and I looked around and there were 12 people near the front of the line, all that were using that product, and I scratched my head and thought, maybe there's a wider audience. And the wider audience is then what really led to the formation of Epiphany Therapeutics. Today's video is going to focus on two primary subjects: joint pain, rash, and linking them both to inflammation. So I've spent a lot of time in my career in the life sciences studying, trying to understand inflammation and trying to mediate the manner in which it negatively affects our body. Let's be clear, inflammation is an important physiological process. We require it. We would be dead without it. It's part of the body's surveillance system, fundamental to immunity and our ability to fight disease. There is a direct relationship between joint pain and perhaps the inconvenience of rash, including burning. Itch is a major feature. And the interplay of those inflammatory proteins are causative to both conditions. So in joint pain, we think about that being a chronic condition frequently associated with age. I'm not talking about diseases like rheumatoid arthritis. Rheumatoid arthritis, very complicated, beyond the scope of what we think we're trying to touch. We're talking about age-related joint pain, post-recovery pain. In other words, if you've had an injury, if you're undergoing physical therapy, the kinds of things that when you move an element of your body, you feel pain, you feel stiffness. For joint pain, our products tend to work on different joints better than others. What are they? They're the joints where the workings of the joint are closest to the surface of the skin. Knees, feet, ankles, hands, wrists, elbows. The ability for us to deliver and for the body to absorb these micronutrients is enhanced by the short distance that it has to travel. Now, I wouldn't exclude the beneficial effect of our products on other kinds of pain, other conditions, spinal pain, neck, back, even hip. But it's a much more subtle response, and it's one that you simply have to make a decision about on your own. But these cytokines that we talk about are proteins produced by the body's immune system in response to some stimulus. Particularly as we get older, the stimulus becomes a little bit fuzzy, a little bit more common. The immune system becomes a little more confused about what it's doing, and the signaling runs too powerfully, even though there's not an immunological threat to be dealt with by the inflammatory cytokines. So pain is one angle. Rash is when those cytokines are overexpressed, actively overexpressed in the skin. We can think of eczema, and we can think of a chronic stimulus condition like diaper rash. Not a comfortable subject, right? Adult diaper dermatitis. The reality is that as people get older, continence becomes an issue, and routine, chronic exposure of the skin to urine and its breakdown products creates a potent inflammatory response. The presence of diaper dermatitis makes it less comfortable to walk. One of my big themes is stay mobile, stay independent, right? So managing diaper dermatitis has the same impetus as managing joint pain. We want you to stay active, keep the ability to take care of yourself, enjoy your life for as long as possible. I want to be clear, none of the information that I'm talking about today has been reviewed by the FDA. There's no FDA clearance. FDA has its hands full dealing with the drug world. We're trying to deal with the micronutrient world. Everything that's in our product that has an anti-inflammatory effect is in a normal diet each and every day. A question that I get asked a lot is, Bill, why are you focused on topical application to treat an inflammatory condition as opposed to what are the common treatments that people usually use? Let's talk about what those are. People use non-steroidal anti-inflammatory drugs. Those are aspirin, ibuprofen, naproxen, which we usually think about as Aleve, Excedrin. There are other topicals, patches, steroids, things of that nature. What do I think about that, and why am I so focused on our topical approach? One, it is non-steroidal. Two, we're trying to treat the site of need. We're trying to focus the benefit of the micronutrients to where the body quite clearly needs it. So what are the problems with those non-steroidal anti-inflammatories? First of all, they touch everything in your body. They're not specific to the site that you need it, so you take a much larger dose than would otherwise be necessary, number one. Number two, they're cleared through your kidneys and or liver, depending on the drug that you take. And while that's a natural component of physiological function, over time it's not good. You will, if you read the warnings on bottles of the products that you take, they'll say don't take with alcohol, don't take in excess, don't take for longer than 2 weeks without consulting your physician. There's reasons, there are negative side effects associated with chronic use of those products. So let's talk about two of the big elephants in the room, particularly as it relates to pain. We have opioids, pain and rash. We have steroids. Both of those have significant negative consequences. Let's talk about steroids first. Steroids are taxing to your liver, specifically, absolutely taxing to the liver. They have a tendency to thin your skin, and there is some lifetime maximum of corticosteroid exposure that any of us should subject ourselves to. Opioids very common topic of conversation these days. They start as frontline treatments for acute pain, frequently after a significant injury, after surgery, but become part of a lifestyle, become addictive, and can lead over time to really significant negative consequences. What we're trying to avoid is the negative consequences of all of those options, whether it be the over-the-counter drug medications, the opioids, or the steroids. Avoid those, deliver what your body needs, deliver what your body lacks, and that you're unlikely to be able to absorb when you take an oral vitamin. So I've already spoken about why we believe our products are effective, the kind of conditions we believe they're effective in. I'm going to do some crass commercialization here and tell you which products are applicable to which conditions. When I talk about joint pain, I'm talking about our product Endurus. The name Endurus did not come about by chance. It is about enduring on the one hand and endurance on the other. Reducing your pain response makes you more comfortable, less distracted by the pain, and the ability for that response to carry over time is one of the important features of the product that I don't personally find anywhere else. When I use Endurus, I'm just going to tell you what I do. I use it on both of my knees, and off of the center of my kneecap, I'm probably 4 inches above, 4 inches below, front and back. That's a dollop of lotion that is the size of a quarter. Again, I try to do it 3 times a day. What I have learned is that if I completely miss a day and don't use it, it's okay. I've saturated the tissue, which is my goal, and it has a continuing response. So using Endurus as your own body cream, using it because you have specific joint pain, either way you get at it, Endurus is about pain. We've also talked about rash. Because I focus a lot in my life on issues of the aging population, and again, I've been in the life sciences my entire career, and I understand some of the degenerative diseases we have. I understand how the body begins to malfunction, not send the right signals, make too much of one protein, not enough of another. My goal is to help myself, my loved ones and friends, and you enjoy your life, stay independent. Diaper rash, adult diaper dermatitis. We developed Remedius, the second product that I'll talk about, for exactly that condition, right? Routine use after cleansing the perineal area, just a simple application of Remedius once or twice a day has been shown to be very effective in helping patients manage the symptoms associated with urinary incontinence. So Remedius plays this role in itch, burn, reduction of inflammation. Another thing you'll notice in diaper dermatitis is how rapidly the skin will go from being a bright pink to being a normal tissue color. It's strongly suggestive of the potency and rapid response associated with Remedius. Third condition we talk about is eczema. Eczema is a chronic autoimmune disease. You have eczema on your face, on your knees, on your neck, on your hands. It's very visible, and people are self-conscious about that and they don't like it. The other thing is itch. Itch and eczema go hand in hand. And unfortunately, it's hard to not scratch. When people scratch frequently while they're asleep, they don't even really realize what they're doing. They scratch and scratch. They get open wounds. They get scars. The scars are for life. Their skin is permanently changed. What we observe with eczema is a very potent response. There's no cure. We're not going to cure eczema. Today, no one else is going to cure eczema. Again, it's a chronic autoimmune disorder. But what we've observed that we can do is significantly reduce those two primary symptoms of redness, itch, and burn. In some patients, they're able to take and eliminate those symptoms completely. Do they still have eczema? Yeah, they do. If they stop using our product, what happens? Probably comes back. If they continue using the product, we've had no reports of anyone who has consistently used our XM product that has had a change in the disease state that overcame the therapeutic benefit of the product. So those three products are really lead the way in what we at Epiphany view as essential inflammatory components in joint pain, in diaper dermatitis, in eczema, and broadly in what we call superficial inflammation. So you've listened to me for a while. Thank you for doing it. I'm pretty passionate about what I do. I'm pretty passionate about the things that I know. You don't only have to listen to me. You can go to our website, epiphanytherapeutics.com. There are written testimonials, video testimonials of people that use and have used our products in the past for everything from joint pain to rash. They'll address a variety of conditions. Their stories are far more important than mine. I'm just one guy with an obvious bias. But we invite you to do that. We invite you to submit any questions you may have. Use the info at epiphanytherapeutics.com email address. Let us know your questions. I promise someone will get back to you. We're likely to do more of these informative videos in the future, so I'll look forward to talking with you again. Thank you.